Hi, I'm Dr. Tim O'Carrigan from Limerick Construction Service, New South Wales, and I want to talk to you about the foot and ankle and how amazing it is and the complexity of the foot and ankle, plus some of the challenges that it presents to us as orthopaedic surgeons. The foot and ankle has 28 bones and 57 joints. It's amazingly complex with both bone, joint, tendons, ligaments, and nerves and arteries. And it has basically two functions. One is that it needs to be flexible to absorb shock and to conform to uneven surfaces, but it also has to be rigid to allow you to jump and run and push off. And so it's got to be opposite things at various times, and that creates a challenge for the foot and ankle to absorb all those forces and to perform those functions. The anatomy, as you can see from here, is quite complex, and that there are lots of structures around the foot and ankle that we need to look after when we do surgery. One of the main ones that we worry about as foot and ankle surgeons is the nerves. So the foot and ankle is very sensitive. It's got lots of nerves endings, just like the hand. And that's why foot and ankle pain is so difficult for patients to tolerate. When we do surgery, we're always thinking about the nerves around the foot and ankle and doing what we need to do, but not causing any nerve problems. Patients can get numbness around wounds, and that is usually well tolerated, but if you get a nerve caught up in a stitch, or if the nerve is injured, then it can lead to a painful area called a neuroma, which is a significant problem. And this is an example of where a nerve has been tethered by a stitch, and that needed surgery to relieve that pain for that patient. Around the back of the ankle is the tibial nerve, and that passes under some bands that form a space called the Tarsal Tunnel. It's similar to the carpal tunnel in the hand, which people are more familiar with. The Tarsal Tunnel can get narrowed, and it can put pressure on the nerve and cause pain. And so this can be a significant cause of pain in the foot and ankle. It's less common than carpal tunnel syndrome, but can require surgery to relieve that pressure. And sometimes we do a tarsal tunnel release as part of corrective surgery to prevent pressure on the nerve and prevent them developing a problem. And so in this, you can see the fibrous bands that the nerve has to pass under, and that can put pressure on the nerve and require surgical release. Sometimes there can be a ganglion or a cyst in the tarsal tunnel, and that can cause pressure on the nerve as well, as you can see on these MRI images. So the foot and ankle is an amazing structure. It is complex, it's interesting and challenging. And one of the main things that we need to look after when we do surgery is the nerves. And that's our focus whenever we do surgery, to try to prevent these problems.